different diseases which may be associated with ischemia, for example, or thrombosis, or something about it. We will see sometimes hemorrhages, and in our today class we will make a classification of these diseases, and we will discuss all of these pathological processes. First of all, we should understand that there are three most important groups of blood circulation disorders. Disorders of blood filling, and here we may see hyperemia and ischemia. Vessels wall permeability derangement, and we may see here hemorrhages, bleeding, and plasmorrhagia also, and blood rheological properties derangement, which are associated with stasis, thrombosis, or embolism, for example. All of these diseases and all of these groups are really important to know and to understand which processes are included in them. And it will be really important when we will discuss some diseases of heart, or some diseases of brain or liver, for example, or vessels. And today we give a great information about all of these pathological processes. First of all, we discuss hyperemia. Hyperemia, it is increases of blood supply in the organ and blood accumulation in the organ. And hyperemia may be divided into groups like arterial or active hyperemia and venous or passive hyperemia. The main idea of these processes is different. In case of active hyperemia, we may see increasing of blood supply to the organ through the arterial. And in case of venous hyperemia, we may see the disorders of outflow of blood from the organ. So we will see some venous thrombus, for example, obturation of venous or obstruction of them, and all of this process has some different etiology. First of all, we should discuss arterial or active hyperemia. Arterial hyperemia could maybe local and general. In case of general arterial hyperemia, we may see only two processes: erythemia or vacuous disease and plethora. Plethora, it is increasing of volume of blood in the organism, which may be associated with our treatment. For example, when we try to infuse a lot of fusions to the organism, and sometimes it may be a lot of solutions which we use in treatment, and something about it will be leads to increasing of volume of blood. And erythemia, it is a malignant disease of bone marrow, which is associated with accumulation of all blood cells in the vessels, and it will lead to general hyperemia. Local arterial hyperemia could be divided into groups like physiological and pathological one. In physiological local arterial hyperemia, we may note walk hyperemia, which is associated with increasing on functional activity of some tissues and some organs. For example, it may be a result of hyperemia of muscles after some exercises in the gym, or hyperemia of lung in case of inspiration, or in case of running, for example. And also it is emotional or physiological hyperemia, which is associated with some stress reactions, for example, some kinds of emotional activities, for example. And local pathological type of arterial hyperemia may be angioneurotic. Angioneurotic type of local arterial hyperemia associated with diseases of nerves, And in case of it, we will see mostly increasing of volume of lumen of blood vessel and increase of blood supply to the organ in result of this process. Collateral hyperemia is associated with activation of anastomosis in arteries which normally are blocked. For example, it's typical for some tissues and organs, for example, like heart. Sometimes we may see collateral in the abdomen wall or something about it, and I hope the definition of collaterals are known to you from your anatomical department. Hyperemia after ischemia, it is a type of adaptation and defense process, which happens like a result to hypoxic injury of the tissues. For example, if we will see some blockage of arteries in some long time, and after it we will eliminate the blockage etiology and factor which lead to blockage of artery, we will lead hyperemia in this organ. Vacate or vacant blood pressure type of hyperemia associated with changes of atmosphere pressure in some areas on our skin or in our organs. Sometimes you may see it in surgical manipulation, and when surgeon use some kind of stuff like aspirator, and if aspirator will took to part of the organ in this area, we will see vacate hyperemia. Inflammatory hyperemia, one of the most spreading type of hyperemias, and we may see it in any inflammatory reactions. So on our next class we will talk about inflammation, and we will know that the first manifestation of inflammation is redness, which is associated with arterial hyperemia in this area, and this kind of hyperemia will be inflammatory arterial hyperemia. About mechanism of its formation we will discuss on our next classes. And in the presence of arteriovenous shunt. So a shunt, it is a communication between artery and vein, which may be result of some traumatic actions with artery and vein in same time. For example, we may see alteration of wall of artery and wall of the vein by one knife, for example, and we will see formation of shunt here. Anatomical manifestation of arterial hyperemia associated with reddening of skin, mucous membrane of tissues and organs. Also, it may be associated with hypertension, so the organs becomes hot and warm, and a rise of body temperature. So the rise of body temperature is associated with huge temperature of arterial blood, because it is one of the defender reaction to inflammation and one of the step of pathogenesis of development of this pathological process. More often, arterial hyperemia has adaptative character, and for organs and for tissues we couldn't see any structure derangements or structure changes in this organ, and that's why we may mark the favorable outcomes here. Venous or passive hyperemia associated with increasing of blood supply to an organ or tissue due to a decrease in the outflow of blood. Blood flow is not changed or reduced. Stagnation of venous blood leads to expansion of veins and capillaries. slowing blood flow in them to the development of hypoxia, which is the main pathogenesis factor, which will lead to some pathological processes in the organs with venous hyperemia. And we have already told with you about arterial hyperemia, and we have already talked that this pathological process will not have any influence to the organs. In case of venous hyperemia, we will see a lot of changes. So we will see great damage of the organs and tissues in result of this pathological process. According to classification, there are two different ways of classification. According to prevalence, we may see general and local type of hyperemia, and also according to the course, we may see chronic and acute type of it. It is really important to note that both of these types of classification could be mixed. So we may talk about general acute and chronic, and about local acute and chronic. General venous hyperemia, morphological substance of the heart failure syndrome. So most important etiological factor for its development is heart insufficiency. When we may see some problems in the ventricles of the heart, we will see venous hyperemia in the organs, which may be acute and chronic, but all of them will have same pathogenesis, and in result we will have same changes in these organs. That's why we will discuss it a bit later and together. In case of common acute venous hyperemia, we will see occurs with acute heart failure syndrome, a completed large focal myocardial infarction, or acute myocarditis, or in other diseases of the heart mostly. Due to hypoxia and increase in hydrostatic pressure of the permeability of capillaries increase dramatically, and we may see some markers of plasmaregia and edema. We also see stasis and hyperemia of the arterioles and venous capillaries, and multiply the epidesis of erythrocytes in the stroma of organs. In the parenchyma, we will see dystrophic and necrotic changes. So we have already discussed dystrophy and necrosis, and they will be associated with all other topics. So the first hour topics are really important for understanding of whole pathological anatomy course. So for example, here we may see some changes which happens in result of venous hyperemia, but all of the morphological manifestation will be associated with our previous knowledge. In the organs, it is really important to note some of them, because the most important for us are lungs, kidney, and liver. In the lungs, we will see edema and hemorrhages. We will see formation of acute pulmonary edema, and it may be one of the most important etiological factor of the death of this patient. So we will see intoxication and hypoxic injury of whole organism, of whole tissues, and previously the brain, like a result of lung injury. In the incision or in the autopsy, we will see a lot of fluids accumulation in the lungs, and we will see some fluids which has red or cherry color in the incision. It is really difficult for treatment and could be one of the step of the dying here. Kidney dystrophy and necrosis of epithelium of column tubes also may be marked in result of this. So we will see a necrosis of the tubes, and the etiological factor will be hypoxia again. In the liver, we will see central lobular hemorrhages and necrosis of the hepatocytes. So Probably all of these anatomical manifestations I have already known for you from our previous classes, and I hope you remember about special characteristics of these processes. For example, for necrosis, it is really important to find some cells without nucleus. For edema, it is really important to find some fluids accumulation between the cells, and one of new uh, anatomical formation is hemorrhages. Hemorrhages associated with accumulation of the erythrocytes or red blood cells uh, outside of the vessel's wall, and accumulation of the erythrocytes between cells of parenchyma of these organs. And in the next slides I will show you some special manifestation. For example, here we may see edema of the lungs, for example. We may see semi-transparent homogeneous masses in the alveoli. So we may see these light pink masses in the alveoli, and it is a marker of lung edema here. So I hope you can see it clearly. Morphological changes in tissues associated with hyperemia of veins, and it is really easy to find it. Vein in the histological examination will have some different kinds of morphological characteristics against arteries, and we will see some special changes. So we will see that large vessel will accumulate a lot of blood. Stasis is also interesting because we will see a lot of erythrocytes in the small arteries and small vessels in the parenchyma of the organ. Edema of stroma of organ, and I have already shown you in the previous slide, and depidesis of erythrocytes. Depidesis is a type of hemorrhage when we may see high increasing of permeability of the vessel and accumulation of red blood cells instead of the arteries. And also we will see dystrophy of parenchyma. It could be any types of dystrophy, and it may be mixed degenerations, it may be parenchymatose, stromal vascular proteinous, mostly proteinous degenerations here, or fat degeneration also possible. And also necrosis. I forget put it to the slide, but necrosis is also possible for morphological changes. And the process sometimes may be reversible. So if we eliminate the factor which leads to venous hyperemia, and we restore the function of the heart, for example, we will see fixing of all tissues and organs in result of it. Common chronic venous hyperemia or plethora associated when we may see patients with chronic cardiovascular insufficiency, which may be associated with heart defects, coronary artery disease, chronic myocarditis, or cardiomyopathies, and some other types of chronic heart diseases. Long maintaining in the state of tissue hypoxia leads not only to plasmorrhagia, edema, stasis, but also to atrophy and sclerosis of the organs. And one of the most typical anatomical manifestation of chronic venous hyperemia will be development and overgrowing of connective tissue here. Morphological changes in the organs. Organs become enlarged. Organs are solid, very solid, because we may see a lot of blood accumulation in them, and also development and overgrowing of connective tissue. And tissue is dark red color with cyanotic tint. In hypodermic cellulosa at the venous stagnation, we will see common edema, anasarca develops. So sometimes we may see that edema develops in wall tissues, in wall localization, and it will have name anasarca. Fluid accumulates in serous cavities like hydrothorax, hydropericardium, and some other types of these fluid accumulations. So any special accumulation of fluids will have some special names, and you will use it in your clinical practice. Morphological changes in the organs will be different, so we will see cyanotic induration in the skin, kidneys, and spleen. So the organs becomes blue or some cyanotic color, they become solid, and we may see increase of their size. The liver becomes nutmeg, brown induration of the lungs is development. The skin becomes cold and bluish or cyanosis. The veins of the skin and subcutaneous tissue are dilated, filled with blood. Lymphatic vessels are also enlarged and filled with lymph. Swelling of the dermis and subcutaneous tissue are also possible. Also, we may see proliferation of connective tissue in the skin. Kidneys are enlarged, dense, and bluish or cyanotic again, and in the spleen we will see dark cherry color on the excision and non-scraping of the pulp. On this slide we may see nutmeg liver. The nutmeg is a special kind of nuts which use in their cooking. And on the incision, the nutmeg has same color and same anatomical manifestation with nutmeg liver. That's why we call liver like with nutmeg liver. The liver is enlarged, dense, its edges are rounded. In the cut, we may see some light yellow colors and dark red spots. And the most important things which happened in these cells, in these areas, will be associated with venous hyperemia in the dark red areas and with the parenchymatose fatty degenerations in the yellow one. On this slide we may see brown induration of the lung, and in the lung lungs becomes solid, they becomes brown color, and the changes of lungs are associated with venous hyperemia, diabetes, and formation of special pigment hemosiderin here. Also, histologically, we may see brown induration of the lung. We may see, and here we use special reaction for them. And I hope you remember this slide from our third lecture about mixed degeneration. We use Pearce reaction, and hemosiderin becomes green-blue. And here we may mark it here. Morphological changes in the tissues associated with edema, permeability increase due to hypoxia, diapedesis of erythrocytes, dystrophy of parenchyma, necrosis, sporoma expanding, and organ sclerosis. In the result, we will see parenchymatose atrophy, stroma sclerosis, and organ sclerosis. So all of them will be associated with two processes: overgrowing of connective tissue and atrophy. Local venous hyperemia may be associated with some special conditions which associate with blockage of veins and probably thrombosis of veins or compression of veins by tumor or some other substances. And also it may be collateral venous hyperemia by opening portocaval anastomosis or portocaval shunts, for example. Ischemia, it's a different type of disorders associated with blood filling, and here we may see decrease of a blood supply to an organ, and most of all it is as a result of insufficient blood flow. According to classification, there are general and local type of ischemia, and both of them may be acute and chronic. Ischemia types according to development mechanism. It may be in result of arterial spasm, closure of the artery through the thrombus or embols, with artery compression by tumor, effusion, or some other kind of compressions as a result of redistribution of blood. So it is the most important mechanism of ischemia development, and in the cases we will ask you about some different mechanism of development of ischemia, and you may use this classification. Morphological manifestation of ischemia associated with decrease of organ size, platelet consistent of it, paleness of organ, wrinkled capsule, and ischemia outcomes will be associated with some different kinds of it. Without consequence in case of angiospermic form, for example, in case of short duration of spasm, degeneration and necrosis in case of acute form, and one of the most important outcome will be associated with atrophy and sclerosis in case of chronic form. Bleeding or hemorrhage. Hemorrhage, the exit of the blood from the lumen of the blood vessels or heart cavity into the environment. And the bleeding here will be external bleeding or in the body cavities, in case of internal bleeding, for example. External bleeding may be associated with hemoptysis, nasal hemorrhages, blood vomiting, blood stool, and urine bleeding. Internal bleeding associated with hemopericardium, hemothorax, hemoperitoneum, hematorosis. There are some different kinds, types or causes of bleeding. They may be associated with rupture of vessel wall and with a wound in the wall or development of pathological process in it, inflammation, necrosis, or aneurysm. For example, it may be associated with aortic media necrosis, syphilitic mesoarthritis, rupture of the enlarged liver and spleen, cardiac, aortic, cerebral, arterial aneurysm. The second cause of bleeding may be associated with erosion of vessels wall with inflammation, necrosis of the organ of the wall, and malignant tumors. In the inflammatory focus, in case of alteration, in tubular pregnancy, in necrotic zone. And the third cause is increasing of permeability of vessels wall, and here we will see diapedesis. And diapedesis will be associated with dramatically increase of vascular permeability, and diapedesis associated with small pointed accumulation of blood in the organs, and it may manifestate itself in hypertension conditions, in systemic vasculitis, some infection diseases like typhus or scarlet fever or sepsis, diseases of hemopoietic organs, DIC syndrome, and hypoxic states. Types of hemorrhages. We should know that all morphological manifestation of hemorrhages could be different in case of different reasons and different volume of them. Hematoma, it is an accumulation of coagulated blood in the tissues with violation of its integrity and the formation of cavity. So the most important morphological marker of hematoma will be cavity. In hemorrhagic soaking, we will see a lot of erythrocytes between tissues, between cells of the tissue, and it will be soaking. Hemorrhages. It may be planar hemorrhages in the subcutaneous tissue and the muscles, in case of rupture of muscles or in case of rupture of subcutaneous vessels. And petechias. Petechias, it is a small pointed hemorrhages in the skin and mucous membranes. Mostly we may see it in case of hypoxic hemorrhages in the stomach, for example, in case of hypoxic condition. The outcome of hemorrhage could be different, and it may be formation of a cyst in some organs, most typical for brain, mostly encapsulation or germination of hematoma by connective tissue, which happens in all cavities of our organs. Mostly it may happen uh, in the thoracal cavity or abdominal cavity, separation upon appearance of infection. So sometimes we may see addition of infectional process to the hemorrhage, and it will be one of the most unfavorable outcome. Consequence of bleedings and hemorrhages depend on speed, volume, and localization of hemorrhage. It is really important to understand when sometimes different characteristics of these factors will have different outcome. So if we will see huge volume and short time of the bleeding, so high speed of bleeding, we will see that this bleeding may have some dangers for life, maybe be dangerous for life. And different situation when we see huge speed, low speed and huge volume, we will see that this type of hemorrhage may don't have any complication. Intestinal fluid content derangement associated with formation of transudate, associated with edema, dropsy, anasarca, hydrothorax, hydropericardium, and ascites, and all other types. Types of edema may be local and general edema, and we have already discussed all of them in our previous slide. Local edema may be like a result of allergic reaction, as a result of venous congestions, as a result of lymphatic congestions, and general edema may be associated with cardiac edema. Sometimes we will see heart insufficiency, and we have already discussed it when we talk about venous hyperemia. Hypoproteinic edema associated with problems with nutrition and decrease of oncotic pressure in the blood. Renal edema associated with renal insufficiency. Pulmonary edema associated with edema localized in the lungs. Brain and cerebral edema will have great complications and sometimes may lead to death of the patient. Serous cavities edema, and we have already discussed them in our previous slides when we talk about accumulation of some fluids in our normal cavities. Stasis. It is a sharp slowdown and stop of blood flow in the vessels of the microcirculatory channel, and mostly it happens in capillaries. There are a lot of different causes of stasis, like discus circulatory disorders associated with infectional intoxications of venous, plethora, and shock. The mechanism of the stasis development associated with slush phenomenon, which characterized by inheritance of erythrocytes, leukocytes, and platelets to each other and increase in plasma viscosity, which leads to difficulty in perfusion of blood through the microvascular vessels. Studies in the capillaries of the brain poses the greatest danger. The capillaries and veins dramatically expand, overflow with red blood cells stuck together in the form of the coin column. Edema develops in the brain substance and may lead to death of patient here. Long-term studies in the brain lead to the development of focal necrosis, which clinically manifestate in brain coma. And thrombosis, the next type of rheological problems of the blood. It is an intravital blood coagulation in the vessels and or heart cavities. The blood bundle formed during the process is called thrombus, and sometimes we may see coagulation which may happen after the mortem, and it will be clot after the death. Thrombosis is one of the most important mechanisms of hemostasis, and in normal, but sometimes we may see that thrombus will form in pathological conditions, and the formation of thrombus in vessels will lead to great problems, which may lead to a lot of different diseases. For example, it may be associated with myocardial infarction, it may be associated with gangrene of the extremities and some other kinds of disorders. Pathogenesis factor may be associated with local, like changes in the vascular wall, slowing down and disturbance of blood flow. And also it may be common factors, imbalance between coagulation and anticoagulation system of our blood, and changes in the blood quality. One more process may lead to formation of thrombus, and it will be inflammatory processes in the wall arteries, which may be associated with damage of vascular wall. Not only changes in vascular wall, but also in damages of it. The risk thrombosis is increased in the following situations, like long bed rest after surgery. So sometimes we can see patients with really difficult operations. Sometimes it may be associated with fractures or something like that. Some conditions, some kinds of pathological process. It's not only ruptures, but sometimes it may be some malignant tumors or great operations in the abdominal cavity, and we may see after it long term of fixing of the patient in the bed, and in the moment when the patient stand up from the bed, we may see that thrombus attacked him and he died. Chronic cardiovascular insufficiency or chronic venous plethora, which may be associated with heart insufficiency also. Atherosclerosis. Atherosclerosis will lead to damage of blood vessels wall, and that's why we may see some thrombus formation here. Malignant tumors also. Pregnancy, cause the uterus will blockage some general vessels in our body, and it will lead to formation formation thrombus. And congenital or acquired hypercoagulative states. Thrombus and postmortem clots should be differentiated in the pathological anatomy practice. In the clinical, thrombus are dry, fiery mass of gray to red color with road surface. In the clot, we may see smooth, rubbery, and gelatinous, and it's not adhered to the artery wall. There are some different types of thrombs. You should know three of them: white, red, mixed, and high-line thrombus. White thrombus can consist mostly from the plates and fibrin. Red thrombus mostly associated with erythrocytes accumulation in the thromb. Mixed thromb characterized by mixing of white and red thromb. And high-line thromb, it is a special type of thromb which formed in the vessels of microcirculatory channel, mostly in the capillaries, and this thrombus typical for DIC syndrome, for example. According to Lumen, there are obstructive or obturating thrombus, mural thrombus, and ball valve thrombus. Thrombosis consequence may be associated with obstructive diseases like acute venous hyperemia, acute ischemia, and infarction, and perital, like chronic venous hyperemia, prolonged ischemia with development of atrophy and sclerosis. There are different outcomes of thrombosis. They may be favorable and unfavorable. In case of favorable outcome, we may see aseptic autolysis, so the thrombus just disappearing from the vessel without any morphological changes. The organization of blood clot will be associated with development of connective tissue, development and overgrowing of connective tissue in the thrombus. And why this type of outcome is favorable? Because here we will see the stabilization of the thromb, and that's why it is favorable outcome. And calcification, accumulation of calcium salts in the thrombus. The separation of a blood clot with development of thromboembolism is unfavorable outcome, so we will see spreading of some particles in the bloodstream. Septic melting of thrombus will be associated with spreading of some thrombotic masses with blood flow. And it will be really dangerous for patient because may lead to injury of some new areas, and will lead to ischemia and necrosis in new areas of the body, and may lead to great complications of a thrombus. Embolism. Embolism is an circulation in the blood or lymph some particles which couldn't be found in normal conditions and blockage of vessels by them. There are some different ways of transportation of the embols. It may be orthograde embols or through the bloodstream, and retrograde embols against the bloodstream. And also we should remember about paradoxal way of spreading of embols. It is possible only in case of some anatomical changes in the heart cavity. Most of all, it is associated with some defects in the heart wall. There are some different types of embols. First of all, we should remember about thromboembolism. It is one of the most common type of embols. So first of all, presents thrombus, and through the thrombus we may see spreading of some pieces. In case of gas embolism, we may see accumulation of nitrogen bubbles in the blood, like a result of changes of atmosphere pressure, and it is typical for some caisson walkers. Air embolism, air embolism typical for some wounding of venous of the neck, and wounding of mostly venous, and accumulation of air in the bloodstream. Fat or oil embolism associated with huge fractures of bone with rupture of bone marrow and subcutaneous fatty tissue, and accumulation of these particles in the blood. Tissue cellular embolism, typical for malignant tumor spreading process, for metastatic process. Microbial embolism, typical for some generalized type of infections, sepsis for example. And embolism by foreign bodies, in the result of it we may see some kinds of stones, some kinds of bullets in the bloodstream, and some other particles in the bloodstream. Thromboembolism. So I have already told you about these forms of embols. All the information you may see on the slide, it will be doubled my words. The consequence of the embols associated with heart failure due to pulmonary embolism, and sometimes it may lead to stopping of the heart and dying. Infarctions, mostly like a result of acute ischemia development in the organ. Tumor dissemination for tissue embolism, for example. Generation of infection for microbial embolism. Metastatic abscess, again for microbial embolism, aeroembolism and caisson disease, like in case of gas embolism, acute pulmonary failure, heart failure, and so on. DIC syndrome, it is a disseminated intravascular blood coagulation syndrome associated with disseminated formation of small thrombus in the microcirculatory system of the whole organism, combined with blood incompatibility, lead to multiply massive hemorrhages. There are a lot of different causes of it, like infectional disease, neonatal or intrauterine diseases, gynecological disorders, liver diseases, malignant tumors, small vessels, vasculitis, major traumas, intravascular hemolysis, and so on. Shock. It is a clinical state which connected with a decrease of the effect of cardiac outflow, derangement of microcirculatory system, autoregulation, and characterized by generalized attainment of tissue blood supply, leading to destructive changes of the internal organs. Types of shock, according to etiology and pathogenesis, may be associated with hypovolemic shock, like a result of decrease of blood volume in the organism. Cardiogenic shock, associated with decrease of heart function activities. Septic shock, like a result of intoxication by infectional diseases. Vascular shock may be anaphylactic, like a result of increasing of immune reactivity, and neurogenic or traumatic shock, like a result of wounding of a lot of vessels with great losing of volume of blood, and anaphylactic again. States of shock development were non-progressive or early stage, include of the mechanism state for a decrease in cardiac output to maintain the perfusion of vital organs. Progressive state, depletion of compensatory mechanism tissue hyperperfusion and metabolic acidosis, and blood is sequestrated in the sharply expanded capillaries bed. There are a deep collapse here, some manifestations of deep collapse, and irreversible stage organ damage and metabolic disorders. Changes in the organs in result of a shock associated with necrotic changes in the kidneys. So we have already discussed the necrotic nephrosis, when we may see absence of a nucleus in the kidney cells. In the lungs, we will see focus of atelectasis, serous hemorrhagic edema appear with fibrin falling into the lumen of the alveoli and hyaline membrane development formation. In the liver, we will see central lobular necrosis. In the brain, we will see also necrosis. In the gastrointestinal tract, we will see hemorrhage.